So now we're just cleaning off the forehead to prepare for the injection. And now I'm going to mark the areas where I'm going to inject, and raise your eyebrows up. And Kayla doesn't have very significant forehead wrinkles. And raise your eyebrows up one more time. I'm going to mark the areas where I see them most prominently. And the forehead muscle is called the frontalis. Now I'm going to have you frown, put your eyebrows together. And again, the frown lines here are not very prominent. Normally we would inject all the way across the tail of these muscles that are causing the frown lines, but for Kayla, she doesn't have really deep frown lines, so we'll do less of an injection there. And now squint for me. And the muscle that causes the squint lines is called the orbicularis. It's a muscle that surrounds the eye. By injecting the orbicularis, we also may cause a little bit of a raising of the eyebrow because the muscle is below the eyebrow and is pulling it downward. In contrast, the frontalis is a muscle that pulls the eyebrow up, so we want to be careful not to inject too much in the frontalis because it can cause the eyebrow to drop. And put it there, and also put it on the sides there. All right, we're going to go ahead and inject the frown lines. Because her wrinkles are not prominent, I'm only using 5 units in each area here. For somebody with really thick frown lines and really strong muscles, I would use more. Now we're going to inject the squint lines or the orbicularis muscle, which is right underneath the skin. So we inject very superficially. How does that feel?
Right.
Sorry, this is before the Botox has taken effect. So the frown line's right there. Frown as hard as you can. That's good. And now squint. And you gotta look at both sides. Okay. All right, and so in 10 days we'll see how it looks.